Alright team, let's discuss the case. The patient presents with symptoms of an upper respiratory tract infection, pylophlebitis, and alcoholic hepatitis.
Based on these symptoms, I think it could be a severe liver infection like pylophlebitis.
I disagree. The presence of alcoholic hepatitis points more towards a liver-related issue than a respiratory one.
Actually, I'm leaning towards an upper respiratory tract infection, given the patient's history of alcohol consumption.
Enough. The correct diagnosis is polyorchidism.
Polyorchidism? That doesn't even match the symptoms.
I don't care what you think. It's polyorchidism. And we need to perform a hemispherectomy immediately.
But that's a risky procedure. Are you sure, Hawks?
I don't make mistakes. Get ready for surgery. We're saving this patient's life. Tracy, thanks for calling me in. I need to perform a hemispherectomy on my patient. I strongly believe he has polyorchidism.
Hawks, I understand your concern, but hemispherectomy is a major surgery. Are you sure about this diagnosis?
Tracy, I've been a neurosurgeon for over 15 years. I know what I'm doing. Trust me on this. I have the experience.
I get that you have experience, Hawks, but we need to be absolutely certain before we proceed with such an invasive procedure.
I can't believe you're questioning me on this, Tracy. I know my patient better than anyone. Trust me. This is the right course of action.
Hawks, I find it hard to trust you because you do this every single time a patient goes through your department.
When have I led us wrong? Do I need to perform a hemispherectomy on you to prove I'm right?
Is that a threat?
It's a proposal.
Oh, not again! The patient is in critical condition. I shouldn't have gone through with the hemispherectomy. I have to tell Hawks that it was the wrong treatment for polyorchidism. How do I explain this mistake? Maybe I should have tried out the hemispherectomy on myself. Then again, has the window in this room always been open? I could just leave and blame the patient's condition on our stupid interns. That's what Hawks would do if he were in my shoes. Ah, fuck it.
What? What in the world were you all thinking? You nearly killed our patient with the wrong hemispherectomy and misdiagnosis.
But Dr. Hawks, we were following the symptoms we observed.
Yes, it seemed like the right call at the time.
I still believe our initial diagnosis was on track.
You're all incompetent fools. How many times do I have to remind you to trust your training and not jump to conclusions? You've let me down, the patient down, and most importantly, yourselves down.
We apologize, Dr. Hawks. We will do better next time.
Please give us another chance to prove our capabilities.
We are truly sorry for the mistake.
I have no time for mediocre doctors like you. Figure out the correct diagnosis amongst yourselves. I'm done here. Storms out of the room. I can't believe I couldn't figure out what's wrong with the patient. It's driving me crazy.
Oh, come on, Hawks. You're the best doctor here. Maybe you just need to look at it from a different angle. Have you considered a possible allergy?
I did think about that, but no, it doesn't add up. It's not an allergic reaction.
What about a rare condition? Sometimes the simplest explanation is not the right one.
You might be onto something there, Johnson. Let me think about it some more. Wait a minute. I've got it. It's a genetic disorder that was overlooked in the initial tests. Thanks, Johnson. I have to go. Goodbye.
Hey, wait. Where are you going? What did you figure out? Hawks. Unbelievable.
Sorry for the intrusion, but we have a critical case here that needs immediate attention.
You can't just barge in here without proper gear, Hawks. What are you thinking?
This is highly unprofessional, Hawks. You need to follow protocol.
I agree, Hawks. You can't just disregard safety precautions like that.
I know what I'm doing. Trust me.
This patient doesn't have polyorchidism. It's Niemann or Yerpich disease type C. We need to act fast.
Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks.
This whole ordeal wouldn't have happened if you just listened to me in the first place.
But Hawks, the wrong diagnosis nearly killed the patient. You should have trusted my expertise.
Your expertise. You misdiagnosed them in the first place.
I made a mistake, but you could have handled it better instead of going behind my back.
Well, maybe if you weren't so stubborn.
Stubborn.
You're the one who refused to listen to any other possibilities.